ahead and swallow. I remember you recorded me last time, right?
Yeah, I share everything with my brothers.
Yeah.
He might not want you recording him.
No, I'm just,
One
I
second.
don't have him. I just have these.
Swallow. Does this bother you in your throat, this thyroid?
Not so far.
No?
I eat good. Swallow it.
You do? No
Yeah.
trouble swallowing?
Mm-mm. No problem swallowing.
Okay, Dr. Trepp sent her to see me, right?
Dr. Trez.
Swallow.
You trying to choke me to death.
No, I'm not. I'm trying to feel that gland to
I
see
know
what's
what
the
you're
problem.
doing. I know what you.
I'm trying to feel that gland. So
So
anyway,
you'll know what's going on. Oh yeah, Tiffany, you're
she
mad.
was treated with methimazole. She has a history of hyperthyroidism.
That is correct.
Right, and she also has a goiter that goes down into the left side of her throat. Dr. Castro saw her and sent her to see me.
Mm-hmm. Castro.
And you got hot nodules on both sides.
Who? What is that?
Hot nodules?
Uh-huh.
They're nodules in your thyroid that make too much hormone.
Yeah. Well, how you get them out?
Well, you can remove them surgically with an operation.
In my throat?
Yeah, but however, there's other options here. Let me ask you a question. Is she on medicine for hyperthyroidism?
She's not on any medication.
She's not on any
Not
medication.
for thyroidism. And you know, when we were here last time, you sent her to the hospital to have some tests done too.
Right, the CAT scan. I
Yeah.
just looked at those images. And yeah, this thyroid extends down into the upper part of her chest.
Down here?
It's way higher. It's on the left side too. It's just under this bone. I just looked at the CAT scans.
Okay.
Oh my God.
You know,
She's not. I have to admit, she's doing exceptionally well. She doesn't have never complaints about her throat or anything ever.
nothing.
The only problem she's had is when she first moved down here, they thought they had diagnosed her with COPD, and of course, her primary recommended, to have everything checked, and that's when we found out that she had,
Oh,
Thyroid.
yeah, and we started from there. But she hasn't had any problems, no sore throat, no hoarseness, just but it wasn't COPD, it was more asthma, but she was coughing up a lot of
this I was inhaling.
so they put her on some steroids and some inhalants. She sees Dr. Upartier for that, but they did want to follow up on the
Thyroid.
thyroid.
What causes thyroids?
What causes the thyroid?
Yeah.
It just happens.
They do.
It just happens. So, we have a little dilemma. I tailor my recommendations for my individual patients, right?
Right.
So, it's not like she has an enlarged goiter more on the left than the right. It does extend down into the chest. And she had a nuclear scan done that shows that she has hot nodules.
What is that? What's this hot nodule?
They make too much thyroid hormone.
Okay.
So if we wanted to avoid surgery for her, I mean, if she were eager to have this surgically fixed, if she was much younger and wanted to get that out, I would operate on her. She has indications for surgery. She has a substernal goiter, and I would be happy to recommend that. But I get the feeling that everybody here wants to take the path of least resistance and try to avoid an operation if possible.
For my age.
Yeah, she's 84.
I understand.
Yeah.
I understand. Look, I'm not, unless I really thought we were dealing with a malignancy or something, I wouldn't recommend an operation.
Right.
Okay.
Substernal goiter is an indication for surgery, so she has an indication for an operation. But tailoring our treatment for our patient who has other medical issues, right?
Yeah.
Some of the consideration here would be perhaps radioactive iodine.
What is that?
It's a little bit of radioactive pill or solution that you
I
take.
did that.
You had radioactive iodine? Did you have
I had hyper
hyperthyroidism?
also, yeah.
So she has some degree of hyperthyroidism. Do you get palpitations in your heart?
I think, I don't know if she really knows all the terminology that
Yeah.
she's using, but sometimes when she's dressed in or she gets excited and she gets winded and,
Does she get diarrhea? Do you have a lot of diarrhea?
no.
No?
What is diarrhea?
Constipation, but not diarrhea.
Yeah.
Not even constipation. Sometimes she says she feels like she need to be cleaned out, and I'll give her something. But no diarrhea, no constipation. Mm-mm.
Okay, so here's my next question. You have something that can be operated on.
Right.
If you would like to avoid surgery, then I would recommend medical therapy, perhaps radioactive iodine. And I would send you back to see Dr. Castro to be evaluated for that.
Okay.
If I, you say it again?
My question for you is, how I can operate on your thyroid and take it out.
What?
I can do that.
Would that help?
Well, it'll get rid of it, so it's not even a consideration. But if it's not really bothering you,
Leave it alone.
well, maybe medical therapy and radioactive iodine will be
Better.
for you.
What he's saying is that they can give you like a pill to take,
Yeah.
and it'll just kill the thyroid, and that means you have to cut it out. It'll just kill the
Well,
thyroid. He's
For
saying,
my age, you do it the best way.
Well,
If you think,
I mean, I'm happy to operate on it and take
I
out
know
the
you-
left side of your thyroid. I am. It's just that left side that extends down into the chest a little bit. It's not
But you-
blocking your airway. It's not blocking your swallowing tube.
well, can
Yeah.
I take medicine for it? Would that help?
I think radioactive iodine might be of some help.
he's saying yes. That's what he's saying.
Okay.
So she really never knew that she even had a thyroid problem. So this is all new
this is all
information.
just incidental.
Well,
Well, you know, I've always taken her to the doctor when I was in North Carolina to have everything checked and monitored.
Yeah.
But as far as, you know,
Well, things happen like this, and you know you can't feel it because you can't see it popping up. Sometimes they grow down.
now
and in.
what you saying you can do to give me to help me keep from having surgery?
Well, to keep you
To
from
help
having
me.
surgery,
I mean,
I'm going to
Okay.
send you back to Dr. Castro, and he can arrange to give you radioactive iodine.
Yeah.
And he's the one who sent you here
Right,
to be
right.
evaluated for surgery. But you know, I sense that everybody wants to avoid surgery as best
my
as
age
possible.
too.
Well, I mean, we operate on people in their 80s all the
I
time.
know you might operate more than
Yeah.
100, but
Yeah.
Ethel is 84,
Yeah,
and I've been doing great.
I know.
I know you get old,
Let's not rock
but
the
I
boat.
don't think when you get real old you need to be cutting on.
I agree.
Tell it like it is.
All right. I'm going to send you
So-
back to Dr. Castro.
okay.
Okay.
Thank you.
All right.
Now, so he got to check me next.
Yeah, and then we'll see if he can't set you up
See
for
what he's-
radioactive iodine.
Okay.
Okay, because she does have 2 hot nodules. The thing is, she's not really hyperthyroid, you know, but that's really his ballgame.
And so they got something to give you for it, or you don't know yet?
She's got a. She
Yes, I understand.
Yeah, he's gonna give you something for it.
Yes,
So y'all won't.
options. There's always options.
So y'all won't have to be cutting in my throat.
If you want it, let me know.
You like you ready now?
Let me know.
Thank you so
Okay,
much.
It's nice to see you
All right,
again.
nice
Thank
to
you
meet
so much.
Thank you.
So
All right.
you said